Nucleus fasciculatus is seen in medulla, which artery is formed by joining of two vertebral arteries, basilar artery. Pyramidal cells are seen in cerebrum. Posterior cerebral artery is a branch of which of these basilar artery. Nucleus of oculomotor nerve is in midbrain. Posterior communicating artery is a branch of internal carotid artery. Diencephalon represents third ventricle. All tracts passed through superior cerebellar peduncle except olivocerebellar. So, which tracts pass through superior cerebellar peduncle? Tectocerebellar, rubrocerebellar, and cerebellorubral. Corpus callosum is commissural fibers. Cerebellar cortex contains Purkinje cells. Two internal cerebral vein fuse to form great cerebral vein. No embryology. Hofbauer cells are associated with early pregnancy. Mastoid process antrum begins to develop in the 6th month. The development of diaphragm is from septum transversum and pluriperitoneal membranes. Renal agenesis is because of all except failure of ascent of primitives. So renal agenesis is because of defective development of nephritis tissue and failure of ureteric bud with metanephros. Epophoron is a remnant of Wolffian duct. The appendix of the testis develops from paramesonephric duct. Tonsils develop from embryologically from second pharyngeal pouch. Parathyroid gland develop from third and fourth branchial pouches. The precartilaginous analog to bone arises from mesenchyme. Superior parathyroid gland are derived from fourth branchial pouch. Oogonia are derived from yolk sac. Foot plate of stapes is derived from otic capsule. A persistent left superior vena cava usually drains into the coronary sinus. Cleft lip is due to non-fusion of maxillary process with medial nasal process. Uterus develops from Mullerian duct. Which of the following is derived from cartilage of the third arch, greater cornu of thyroid? Umbilical greater cone of greater cornu of hyoid. Umbilical vesicle attains full development in week of development fetus, so 4 week. Patent foramen ovale is due to failure of fusion of ostium primum with ostium secundum. Urachal fistula results from persistent allantois. Length of a mature human spermatozoon is 10 to 40 microns. Which of the following is not a derivative of mesoderm? Gallbladder is not a derivative of mesoderm. The derivatives are ureter, uterus, and epididymis. Weeping umbilicus refers to developmental malformation of allantois and vitello-intestinal duct. Urorectal septum separates the cloaca into rectum and urogenital sinus. Umbilical cord has two arteries and one vein. The reduction of the physiological hernia occurs at 10th week. The testis descends into the scrotum during end of 8th month. Genital swelling in male differentiate into scrotum. The first teeth to appear in an infant as lower central incisor. Structure derived from the neural crest are pia, dental papilla, adrenal medulla, and Schwann cell. Cells of parafollicular cell are derived from fifth branchial pouch and ultimobranchial body. Shotgun perineum is congenital condition in female. Malleus and incus are derived from first arch. The most important structure involved in development of inferior vena cava is supracardinal vein and subcardinal vein. Double Burr body is seen in triple X syndrome. Ligamentum arteriosus is a remnant of ductus arteriosus. Ossification centers for all carpal bone is found by 12th year. Melanoblasts are derived from neural crest cell. Somatic afferent column arise from which part of the nuclear neural crest? Alar lamina, which is not derived from ectoderm. Sclera of eye is not derived from ectoderm. What is derived from ectoderm? Sweat gland, skin, and distal part of anus. Endoderm forms which of the following? Liver parenchyma. The collecting tubule of the kidney is derived from ureteric bud. The following are derived from first branchial except posterior malleolar ligament. So what is derived from first branchial? Anterior malleolar ligament, sphenomandibular ligament, and mandible. Hofbauer cells are seen in placenta. Non-ascent of the kidney is due to faulty blood vessels. Which of the following is formed at birth? otic capsule, and pinna. Which of the following umbilical blood vessel disappear first? Right umbilical vein. Formation of primary ovary in female fetus takes place by 8th week. Skeletal element of second branchial arch is stapes. Regarding zona pellucida, what is wrong? None is wrong, so it is acellular, contains glycoprotein and surrounds morula and it surrounds the ovum. In embryo, the inner cell mass forms the embryonic disc. All are developed from ectoderm except retinal vascular endothelium. So the derivatives of ectoderm are lens, brain and spinal cord. Thymus develops from third pouch. Umbilical vein assumes which of the following position after birth? Ligamentum teres. Proximal convoluted tubule develops from metanephric tubules. The structure derived from the right fourth aortic arch is right subclavian artery. Corona radiata of ovum is formed from follicular cell. During formation of a vertebra, which one of the following is intersegmental in position? Artery. Number of Burr bodies in superfemale is 2. All are endodermal in origin except odontoblast. So, endodermal in origin is hepatocyte, alveolar lining cell. All are mesodermal in origin except dilator pupillae. So, mesodermal origin are iris, stroma, ciliary body, and vitreous. Melanoblast cell appear in basal layer of epidermis during third month of intrauterine life. Midline cleft lip is due to failure of fusion of two medial nasal process. Notochord develops in third week. Commonest type of cleft lip is combined with cleft palate. Exomphalos is a disease involving abdominal wall. C cells of thyroid are derived from ultimobranchial body. True about gastrulation is process by which three germinal layers form. Bone does not present at birth is vitreous temporal. The membranous part of the atrioventricular part of the interventricular septum is between right atrium and left ventricle. At 30 days intrauterine life, optical vesicle appears. The interventricular septum is formed by which of the following? Conus septum, endocardial cushion, and bulbar septum. Following are derived from second arch except malleus and incus. So what is derived from second arch? Stylohyoid ligament, stapes, and smaller cornu of hyoid. Paraxial mesoderm develops into somites. In a female child at birth, oocyte is in a stage of prophase, first meiotic. True about development all except. So what is true about development? All except. So tongue muscle developed from occipital myotome is true, and true and others are false. Parathyroid gland developed from third and fourth branchial arch is wrong. Superior parathyroid gland develops from fourth branchial arch is also wrong, and inferior parathyroid gland developed from second branchial arch is also wrong. True about morula, it is a 16 cell stage and zona pellucida is present. Primordial germ cells develop from yolk sac. Derivatives of neural crest is adrenal medulla, dorsal root ganglia, and autonomic ganglia. In the testes, haploid number of chromosomes are present in spermatids. Anterior neuropore closes on 24 days. Sphincter and dilator pupillae develops from neuroectoderm. All are ectodermal in origin except bone marrow. So what is ectodermal in origin? Cerebellum, anal canal, and sebaceous gland. Meiosis occurs in human males in seminiferous tubules. The germ cells are endoderm of yolk sac. Following cartilage are derivative of second arch except greater cornu of hyoid. So which are the derivative of second arch? Smaller cornu of hyoid, styloid process, and stylohyoid ligament. Clitoris develops from. Incomplete closure of ectodermal cleft is known to cause coloboma of iris and retina. The length of the umbilical cord is 50 cm. Lack of fusion of maxillary and medial nasal process results in cleft palate and upper lip.